Hi everyone, I am Beatrice. In today's video, we will continue with respiratory medications. Our focus today will be on bronchodilators. These are life-saving medication for conditions like asthma and COPD. So we'll be looking at the mode of action, example of medication in each classes, and some side effects we need to know as nurses or nursing students. So if you are ready for today's video, let's begin. Now, the first class of medication we'll be looking at is the beta-2 adrenergic agonist. So when you hear agonist, it means it's promoting or it's enhancing something. So when we say beta-2 adrenergic agonist, the essence is to bind to beta-2 receptors in the lungs, and that will help to promote or enhance bronchodilation. Now, this class of medication, they are available as both short-acting beta agonists and long-acting beta agonists. An example of medication as short-acting beta agonist is albuterol, and an example of a long-acting beta agonist is salmeterol. Now, one thing you need to know for albuterol is that it's a rescue medication. So it's used when a patient is having that acute attack, like in asthma, where they are having acute attack, they administer this albuterol. Now, for the side effect of beta-2 agonists, they include things like nervousness, palpitation, tachycardia, tremors. Now, for patient teaching, you should teach the patient, like I mentioned, that short-acting beta agonist is for acute attack when the patient is having that attack. But for maintenance therapy, it will be long-acting beta agonist. That one is for maintenance, so it's for long-term use. And at times, it's prescribed with a corticosteroid, like fluticasone and all that. So when it's prescribed with a corticosteroid, you should use the bronchodilator first, wait 5 minutes before you use the corticosteroid. So that's another thing you need to teach the patient. The next class of medication we'll be looking at is the antimuscarinics or anticholinergics. The mode of action is to block muscarinic receptors or acetylcholine receptors in the airway smooth muscle, leading to bronchodilation. Now, just like beta agonists have short-acting and long-acting, antimuscarinics also have short-acting and long-acting. So in other words, anticholinergics or antimuscarinics are available also as short-acting muscarinic antagonists and long-acting muscarinic antagonists. An example of the short-acting is ipratropium and the long-acting is tiotropium. So this medication is prescribed especially when patient cannot tolerate the beta agonist. Now, the side effect of anticholinergics or antimuscarinics will be anticholinergic effect. So things that has to do with dry mouth, urinary retention, blood vision, they are common with this. So because of that, we teach patients that are taking anticholinergics to stay hydrated. They should drink a lot of water to reduce that effect of dry mouth or feeling dry. And also they can chew sugarless candy to keep that mouth moist. Oral hygiene also is very important. Now, the last class of medication we'll be looking at is the Xanthines. Example is theophylline. You need to know this medication. The mode of action is to inhibit phosphodiesterase and also to increase CAMP. CAMP stands for cyclic adenosine monophosphate. The role of CAMP is to increase relaxation of the smooth muscles of the airway. So that will result in bronchodilation. Now, the side effect for theophylline, first of all, you need to know that it has a narrow therapeutic range. The therapeutic range is just between 10 to 20 micrograms per ml. So because of that, when a patient is on theophylline, they will have to be doing blood draw to ensure that the patient is within the therapeutic range. And also, the side effect you need to note for theophylline or for Xanthines include increased risk of toxicity, because once the patient exceeds that range, the patient can be at risk of toxicity. Now, the side effects that are common can be headache, GI upset, nervousness. Now, at the same time, this side effect can also be a sign of early toxicity. Things like headache, nausea, vomiting, insomnia can be an early sign of theophylline toxicity. So when the patient starts feeling those symptoms that looks as if it's usual with theophylline, you need to monitor the patient closely. Also, you need to monitor the patient closely for signs like hypotension, arrhythmia, seizure. That could be a sign of severe theophylline toxicity. Now, finally, you need to teach the patient to avoid things like caffeine because it could increase that toxicity risk. So that wraps up today's topic on bronchodilators. If you find this video helpful, please like, share, leave your comment and subscribe for more educational videos. Thanks for watching.